Health is wealth. Haksang phaba lanni masi universal truth wani le. Sometimes it is being said that commit to be fit because your life matters. Aduna punsi duga thawai haibisidagi hena luba leite. Aduna haksang si meoyogi haksang si phana nada yektana tinjang kajangdana karamna thamgadage haibisigi wakalol pandamda puthokchariba ISTB gi akanaba hakselgi thauramni. Hello doctor. Hariba thauramsu ming tabiriba ISTB gi viewer sing khurumjari loinina ngasigi episode ta adumutaramna okchari. Hanagumna ngasisu another very important topic ama amuk pudun laksari ngasigi pujarakliba viewer sing da thamjanabagi damak ojik leijariba topic si modern treatment of heart attack. Haibadi heart attack ki anauba layeng pathap haibasini. Ngasi ki thamjariba topic sigi expert doctor wain hojik aikogi studio da lengsin beriba yamna ikai khumnajariba Dr. L. Syam Kishore aduga doctor gi hojik phawda lebiriba degree sing si thauramsi haujadringaida pure singi mafamda kharadang share tawjanabagi tanja du laujage masi pumnamakti natte some important gist to lakot charaga thamjabani. Dr. L. Syam Kishore MD DM All India Institute of Medical Sciences tagi sigi mathangda MRCP United Kingdom UK digi mungloisalapa adugi FRCP London dagini adugi yam hen nungaijabadi only Manipuri cardiologist so far hojik FRCP with FRCP sigi yam marueba sigi program sima adugi mathangda British Clinical Excellence Award winners hojik phawda phangbiri si British ki yam tangba yamna prestigious weba yam lemjeningai weba award ni British Clinical Excellence Award winner sima phangba mungambire hojik na chief cardiologist and chairman Sky Group of Hospital RIMS Road leba Sky Group of Hospital sigi chief cardiologist and chairman lebiri aduga former consultant cardiologist King George Hospital London da matam sangna layeng pathap maruena hojiki heart ka mari leinaba sigi layeng pathap sida kuina thabak tawna lebirame yam hen nungaijabadi American based America the based of Marquis Who's Who Millennium Edition of eminent doctors Pithibi ki power ba cardiologists eminent doctors singsi the tongan ba discipline ni doctors singsi moigi lisama American based Marquis na phongi sigi manungda listed torpu matamda Dr. L. Syam Kishore saknarba doctor sigi mingsu already yaugdana leikre aduna yam hen nungaijabadi sam tangba tungan ba sigi maruena medical lines da degrees ya sukmatik yamna masi procure to bire acquire to bire ana Manipur da sumahena doctor gumba ma lebi basi Manipur gi oina di khwade ge na sautok chaningai ni yamna tangba maru medical science ki asset amani haidana bio sing mafam da han boine thamjiri doctor ngasi ekoi gi studio de lengbir pom ne hello doctor gi thorum sida ngaktang isa yam chinba schedule marks de kai thok piraga bio sing gi especially Manipur gi health ki line da thawai yauna me yengbiriba adu ISTB musibin limbir pasi yam nungaije adu mangasi so se taram uksiri ngasi thamjari tong modern treatment of heart attack sigi line da ai laksage ai han ba wahang si adu amana haujadring edani ai go hisi live earning program ni aduna call su lakpa hore adu marakta horin wari gi marakta tongan ba different corners dagi callers sing na hangbirak pa wahang su khre lokhachage horin doctor na maduma pa kum pibi gani yam nungaije dagi amana hoji sanukchari ba live hello doctor si YouTube live stream tawraga masi instantly worldwide bayana yengba yana mi khudong chabam su ISTB in sinjari ana yam nungaje punamaksi tamjara matungda what is heart attack plabadi dum yam tare adu mahalikna su manipur masi yam common or padung su tawre ana heart attack abasi karmaina tawra pano karmaina tawba anaba makhalbuno heart sida karmaina tawra masina ai han wang wajege doctor amta daida share tabiyo.
Heart attack is sudden onset heart disease when the arteries, one or more arteries supplying the heart, is totally or partially obstructed, resulting in reduction or complete stoppage of blood supply to the heart muscles, causing heart attack, reduction of the function of the heart, or and other complications.
Asina ngasai heart attack definitions tuni aduna ngasai e puriba heart changibu utong sida puriba e si yamna mapung phana pulap lekhiba natragana khara haidi disturb torku matam duneba sida ne heart attack lai se ada heart attack si tawragadi masina sola pum matam da patient si kayam yam serious wege aduga ꯀꯔꯝꯍꯥꯏꯅ ꯇꯧꯒꯦ ꯄꯦꯁꯦꯟꯁꯤꯒꯤ ꯃꯑꯣꯡ ꯃꯇꯧꯁꯦ ꯍꯥꯔꯠ ꯑꯦꯇꯦꯛꯁꯤ ꯇꯧꯔꯛꯄ ꯃꯇꯝ
heart attack si Manipuri language da when I came back from London after 15 years of my practice in the UK mayamna zum haibda tanabada aina tajabada heart attack tawragadi asibagi khayada tai haiba it's a very fitting phrase in Manipuri. Manipuri, I must say in this thing, at this juncture, after travel all over the world, after having experienced extensively in the Western countries, when I came back, I realized that Manipuri language is a very rich language, having so many very nice phrases. Having said that, salvage tauba kanbanga moida balena dinati hajari.
Sina adu maruena khudung thininga di yam oire life se claim tawbiya bagi adu tarsu masi treatable oiba kanbe have lena di oire doctor na very positive le habi the Manipur da posi world gi wena su bagi scenario haitare and purely masi data si collection tawba tawdu nataba ka mai tawri India gi films na heart attack ki posi gi la iba honga iba masak se is da lifestyle se kam thengnari world gi wena kamai tawra Manipur da because sky hospital is heart ki layang na bagi dam ta fight maming set pa Manipur gi adum hospital lamani kaya mam thengna bi Manipur dana kamai tori mai se scenario work kamai.
There's a very important question. Before I left Manipur way back in 1974, around 40 years from now, I spent most of my time outside Manipur. At that time, heart attack prevalence after I came back, I see many patients coming with heart attack, and many of them very seriously. Aduna how common it is, I will see statistically cost. We'll have to, if I have to give you a figure, the Indian statistics study, 10% of the population at one time. See prevalence high, medical term medical statistics is about 10% in rural urban areas and about 3% in rural areas. Aduna Manipur heart attack hengalesi it's not only in Manipur, it's all over India. India, the heart attack prevalence it is increasing day by day, whereas in the Western countries the prevalence of heart attack is coming down. And then Masikisi will be discussing if we get time and opportunity.
Yam nungai be area ma khalna ba yarna bi Dr. Thambiri sam nga jedo aina how doctor pom tam hanga chabaduni ai khoi gi live phone program ne caller sing si call si hek right from beginning call si dum lakpa hore marak sida just aina kitang insert option boina caller sing si kadai no kari wang hang e asi gi thamjari ba topic sing mari lenena ai call khadang lokon be tan jak lojege and especially my viewers ngasi gi thamjari ba topic si modern treatment of heart attack havani and heart attack ki anobalang pathap si hojik Manipur da su madugi availability si leiradana hoji doctor takpiri noren hangbirappa matam da ngasi thamjiriba topic si ga mari leinana relevant wena wahang sing se hangbirakani haina aina thajaba thamjari adumgi puning sinjari ahan brown gi call si ai lokosari hello tajra bi shaiming lepham takpiro aduga wahang
Kumbidagi Robin Samom Koge.
Robin Samom Kumbidagi. Yam Nungajare, caller si ahan caller ni, Nasiki Tom Sigi. Doctor Kariwang, how we gonna have you?
Heart attack of official Matunga Mona heart attack of Tanava, the session town Lakataka. Anisu, the heart attack of official Amazi Guli, sorry. Asi thadok pada guli check char kagadi masada noai taba kai gumba amal loi tare guli check char kana taba asi mumbistu da heart attack or bogi kana sawa riksong loi na to tata khangani
Robert Fondon pai bi ko doctor atop kari kai hangbi nimbale so from general question dong ta widum yaradra dum wang pakung okay Robert phone thambiro aduga doctor na hairakpa phaiden farba health tips ni ngasi yung tang lomin se ko khoi pun khamin tan ja lomin se doctor habiu recurrence ni ahan bada adu thapui
yamna fajaba question ni mayamna khangning bai tare khoi gi heart attack si kamaina कोई थोक्टिंग दसु अदुगा थो मतुंग दसु अमुक हार्ट अटैक तौरतनबा करी मेजर लौगदगे हाइबसे प्रिवेंटिव मेजर हाइतारे हार्ट अटैक तौद्रिङैदा प्रिवेंटिव मेजर लौबसिना प्राइमरी प्रिवेंटिव मेजर कवि हार्ट अटैक तौग्रब मतुंगदा प्रिवेंटिव मेजर लौबसिना सेकेंडरी प्रिवेंटिव मेजर कवि अदा हार्ट अटैक जिकी क्वेश्चन सिदी हार्ट अटैक तौग्रब मतुंगी ओने तौरे अदुना हार्ट अटैक तौग्रब मतुंगदा the chance of having another heart attack is slightly higher than the general population or those do not have a heart attack. Aduna koina khaitang hena seriously lo itare preventive measures da including ko koigi madu koina during this program also will be discussing, but now I will also start with this. Hujik magi risk factor haidana leiba mayam duma control dongna hone itare
tapyu
aduga koigi lifestyle exercise, regular exercise toba, aduga healthy eating hai tare, junk food ko, aduga reduction of salt intake, thum handana chabi ba, adegi thau, yan oily food, try to reduce or avoid, aduga koi red meat hai ba, red meat hai siangang ba, koi meat hai koi sa nga si sa chobo sing ayam dilo red meat ore, si gi si avoid to ba, if possible, if not once a while is not a poison, aduga regular basis chabi da ba. Vegetables and fruits, plenty of water, regular exercise. Regarding the medication, hidak kisi, koigi hidak kujik habi risi sari sad ragadi nungai tes, or lepagadi nungai te lep traga di sari ngai di nungai habisi. It itself shows that the medicine is helping him. Aduna hidak si koi kuina koigi sibu ebu punjijo sagadren haina sagadrene haina khanbi banataba. Punsi sangnaba hidak si khar sasi haiba adumaina adi concept da hidak si darkar leiba ngai and from time to time regular checkup da koi yam hena koi gi yam hena serious oiba natraga di ko heart attack tore di checkup si khar toin torami adi di every 3 months kumba kari kumba da mumu unabada wari batai sara yenge ko adi mai parameters sing yengaga karam hidak si essential for life, essential for prevention. Adu darkar leijagadi ajum gradually thorokpasu adum yaugi
yam ngaji doctor usi ahan ba caller ni Robin na hangbirakpa wahang si ani ne ani maki paukhom si doctor yam clearly aduga point by point fazana haibire adu hoji Robin yam nungai berum gani aduga koi punna haiba ngasi gi thorom si meng taminari be koi punna maksu anu knowledge me am doctor ri khangjeba phangjare doctor thagachari mathangi call mok lokachari hello
Hello.
Tajara habi sai ming lefam takpiro adu wa hang biu.
Ai haje rei kongpan de Baigabati.
Baigabati kongpal dagi. Kari wa hang bi gani ngasi gi subject khang biramani.
Ai gi eco box se ai eco sahi ahum mukki mamangda ahing de tumbada thabak ta e na tawida. Ado hospital da pokhalaga hoji gudi checkup sari thakudingi do phare di hai ado matungda tawdana ba kari section thawang la faketage na doctor daki khangjening ba
jam nungaje Baigabati gi se ado tasengna doctor da thabak sa im pukhat badu heart attack tawboni haiden basi abe confirm ga tawbi bra doctor kai kai hangbini bulai
mani khoi gi thabak chai hai basi ko burning chest pain hai. This is also another expression of chest pain. Aduna chest pain si mai in different forms da manifest away koi chakpa haibama adagi aduga pressure koi pressure effect koi kanagom na phamdar badongna koi constrictive type da adugumagi adwaina su manifest away yawi aduga koi gi sudden onset breathlessness waina angina equivalent haidana adugi adwaina manifest awba su yawi aduga hujik heart attack taughibra haibadugi di diagnosis and how to diagnose haibasima madugi di heart attack tawi haidana lawragadi tawri haiga confirm tawramagadi madugi hana soina haijagiba hanagi first caller da ina answer tawjagiba dumaina magi preventive measure secondary preventive measure kawi madaida duga hidak magi chagadaba madu kogi there are certain drugs which help which are proven to prolong life, to increase survival. The patient heart attack to patient ki mai punji si hena sangdu halle hai bagi praman laiba hidak sing di saba darkar laini aduna kuina punsina ba hidak si chachi hai ba aduga that also helps reduce the another chance of heart attack.
Yam nungaji doctor uji kongpal de bhege batin ham girak wangi ba khum thamjare matang yahum su call se lokot jari si hek lokot paga ring si yes another call la ham lokot jari hum su call loi dori. Hello hello tajara haibiu ming lepham haibiro duga wang hang bi
bambol la kai ni
ming haibiu
bem bem
bem bem bom lekai digi ngasigi doctor selection bin lebire kari kari wang hang bi gani
thabak na ba sorom ba wa ba mihun chong bri khara khangning ba
isagira hang bira ise
mase hat ke mari le na gadra ba aw isagi
okay chahi de kya muk subire
sahi 26 mu sure
no kano yum pan birra pan birra
aw banjare
okay doctor sibok te insoro pum di hang jare adu khum biba yaradra do
yamna maroi questions hang bigre in fact I wanted to ask these questions also adana 26 years old a lady in the reproductive age haitare senior aduna reproductive age da aduga khoi chahi si 26 around 26 oiraga di risk factor yamna leitraga di risk factor si khoi diabetes gumba high blood pressure gumba ko aduga cholesterol yamna wang banataba hyper cholesterolmia gumba leitaba aduga ujik gi policy ga di relevant oide ba ai doi panjarage for the interest of the common viewers history of smoking leitaba ko aduga yamna obese oide ba sedentary lifestyle di famna da yama leiba nataba oiraga di heart attack in female is much less than that in men. Having said that, we cannot ignore the symptoms. We thabak na ba soron ba ba myun chong ba khaidagi ahum sigi dei da heart attack duga uji ain hai gi ain music pijagriba circumstances sing ji keeping this in mind heart attack tawkani hai ba gi akiba di handana lei aduga thabak nare aduga myun chonge myun aduga soron ware hai ga di is probably related to heart aduna checkup amdang tokthokpi ba aduga hojikti yamna commonly koi echocardiography haibisina ahama warni madugi di madu oire aduga ECG lobi matamda ayamba di diagnosis de dum tholani
yamno ngaje duka adana sina marak stage da callsing gi call si ai lokachagani lokachading mangwai nani koi chahi si khara hojikani manipur du yam toin thokpa baroma pangsi kitang chahi si leselakpa haitare middle age gumbo kitang leselakpa matamda ikang kangogdana masi hekta wandagre dagidi sum tumbade hawlaktre dugu lei hidre masi ka haibagumba masi yam tare haitare yam common wore masi se aduna heart attack na si warungani ma heart attack tung si borungani kaina common my assumption presumption haitare si chungadre hekta wanda ba adu mai gi sign symptoms adu sumane ore ko yabse heart attack ki kramai tung
oi middle age miyai haitare ko miyai oi ba nupa male loiraga di aduga risk factors su ama ni leraga di haire jetare ko major risk factors ka haitare ko bp su wangamba aduga diabetes su leba hidak di charamba aduga control the lerami lem di haire ju thoina khangaudraba aduga we suddenly one of the common sudden cardiac death ko imese to yam thuna within an hour or so koi kana to basi legi da basi one of the common causes is heart attack. Aduga, having said that, other factors also to be considered. Familial da koi manglak na ba haidana lai besina sidi heart attack dagi tongali. Aduga heart attack ahing de tok dobe yade habidi leite. Aduga is more commoner in the early hour of the morning heart attack se. Aduga uziki hana family da koi ki kano manglak na den lagi da ba young age ni ko but male koi aduna di edugumba manglak na bagi si di koi Brugada syndrome haidana koi gi mihun jong baji yam hena kana chong badagi ventricular fibrillation do ko dagi masi mai gi pump function si failure ko adu dagi di sudden death oiba aduni aduga siga manabada asik artery supplying the heart muscles called coronary arteries masi obstruction torogana heart attack haiba aduga brain gi artery sing si ai sida amtang control jage brain gi sigi heart ki sidana magi sigi coronary artery sida na jare si coronary artery sina heart ki mapan da chali aduga sina heart ki muscles sing supply doba si block torogana si obstruction torogana heart attack haiba aduga brain gi blood vessel iu tong sing jin manung de chang ga supply tawi ana ma si gi si block torogana koi gi stroke ischemic stroke hai aduga aina London da leading da aina publication ama to aina brain attack so hai gre aduga all gi medical fraternity na dum accept tawi kram da ingon challenge
brain attack
aina ai di heart attack si heart ki blood vessel sing je block to ro matam da heart attack hai raga brain da su brain gi blood supply to ro si blood supply si block to raga attack to ri si brain attack hai de ngai maram nei di hai da aina is given edu no one has challenged so far I think it is accepted aduni
brain attack na second time ma oji doctor sin nabi simasu koi khangjan jore ada laina ase atopa se maruena accident mak thokna kudak tu da haisu ngak ti mi si le do heart attack to usi yam thuna sigal li se yam thuna heta ma si life se claim to usi masi kari gi no adu magi akak na certain kano se reason se
heart attack see not all patients suffering from heart attack will die suddenly, but it is one of the common causes of sudden cardiac arrest, and 95% of the cardiac arrests do not survive. Aduna yam thuna khoi yang hoba to appropriate place that to the appropriate doctor to the appropriate for the appropriate treatment that is vital to help survival.
Adu ragadi mai kan bangam na bagi ta jan so sai haurup da habibu du mai kan ba yadab din nate haidna habibu ba yam nu ngaje andam call se mathang tang kitang lok sai call se call mo ngaje yes call se la ani super round gi ahan ba call hello tajira habibu good evening ming le pham tak pio da wang hang biu
ai bisorjit moyang maya lekai
de gi caller bisorjit doctor da kari wang hang bi gani
sir aina hangjere bisi akogi heart ki problem laiba singna akogi walking chatpa matam sila akogi yamna hard oina chatpa da kari kai ba laibage aduga akogi hypertension laiba adagi sugar wangma kangu adagi adu natana anxieties laiba kangu singsina heart attack thokan bagi suddenly thokpagi kano laibra problem laibra aduga masigi infection na kari kari waigidagi hasi doctor dai khangjaningba
wang se ani ne episode na hangbira isi madu akoigi kano ni akoigi walking exercise to chatpa matamda kara thuba khotpa chatpa si masi kari torokadagi ana heart ki anaba leba missing na haibasina ahan wahang adagi ani subasina maruena yes call sila doctor mathang
ai jage ambagi question si answer to jage exercise is the best medicine. Please take it that way. As I always maintain, I always say to my patients also and whoever I meet, and I always say that there is no substitute for exercise. The exercise, irrespective of ages, angang buare, middle aged buare, ahan buare, exercise is the best medicine. And then exercise having said that, heart attack to exercise to regulated exercise khara horpa khara sum horaga warm up ka toba hama darkar lei madu gi jokoina cardiac rehabilitation haidana heart attack to matung da madu provide tawi inside the hospital as well as outside the hospital adu natabata heart attack to gi daba waraga di blood pressure wangi hypertension lei haidana diabetes lei haidana kogi exercise toba yaroi natra exercise akan ma toba yaroi haibidi leite exercise sidai yam hena chahi matung exercise is related to the amount of exercise to be done is related to the age also. Say for example 60 plus or the cam exercise to have to the 60 plus to 30 plus to the exercise ki quantity to my cam to the kenner have aduna the best way is to just to do exercise for 20 to 30 minutes, 20 to 30 minutes for younger generation, and then say 60 plus about 20 to 30 minutes at least 3 times a day. Aduga if possible then daily. Aduga koigi exercise over times is preferable that it is done on before main meals. Blood supply is around the heart, around the stomach. Abdomen circulation digestion help before meal the exercise it is the best medicine.
Sina han bo hangada hoji doctor have hypertension lere, diabetes lere, anxiety lere. Sumai lebe sing si heart attack torok pagi chances se kayam yam na legi have sina ni suba bisurki wang.
Heart attack to the factors sing they are called major risk factor. Hypertension and diabetes. Duga koi sina anxiety di hengat hanbinu aduga high diabetes aduga hypertension na diabetes they are considered as 2 major silent killers. The moi BB wang basi symptoms pak legende symptom lere kanda yam high weramba na to yam low weramba yawi. Aduga same is the case with diabetic patient. The sugar si wang phana wang about su khangana silently it goes undetected. Aduna it continues damaging the vessels. The diabetes it is also considered as vascular disease. The diabetic patients sing magi blood vessels sing koi heart ki coronary arteries, brain ki cerebral arteries, the kidney ki renal arteries, the peripheral arteries asu affect over ki chance wangi. Aduna madigi relevant koi da test of thobi darkar lai. Aduga hujik kandadi yamna modern society modern science study yamna koi yam sophisticated test laire. Aduna maduna koi heart attack torakani haina ki dana sum laibagi muhuta test dinoma matam kai thokbiraga test relevant test tobiraga acd warningai leite hidak charaga adum koine punsini haina ai leibibana ai phai haina khanjai
yam nungaje as very positively doctor na uragad ma habi si pakumjin thamjar matung mathang call sim lokhachari. Hello tajir habi ming lepam tak pi wang hang biu
doctor je thobal degi nauba kowe
nauba thobal degi nauba kari wang hang bigani doctor tak pi
sir heart attack to buje kai gumba toragadi doctor gi manakta within adi sam pung kargi matungda manungda adi horagadi sidabagi chance leibra adugumba akaknabam matam makak khangjenin mai tare
ya biraba nauba wang se thank you very much. Wang selection jare doctor dai huji pass tok jage yamna koi generalize to common question win lai ado kwadigen phaba treatment se heart attack tawre hai di khangagadi matam akakna by stipulated time within time framework hai dare ado labor comment to
sigi yamna this is a very important and intelligent question I should say. Time is essence, time is muscles right. Adana time is very precious. If somebody has just suffered from heart attack, yamna thuna to the nearest health center da ECG lok thok biba confirm to biba aduga koigi first set treatment khara to biraga to the nearest koigi tertiary care center hai tare heart attack center heart attack treatment center hai tare duga nangna drug so koi district hospital the specialist leiba hospital da anakpada thuna yobi hoba aduga hujik kandi koi age of modern society age of 21st century doctors are also well aware that the time is essence aduga the first 1 hour is golden hour di kawi aduga su America da bhagda within mari doctor gi first medical contact kawi as first medical contact see from the onset from the time of onset of the symptoms just ben thabak na badagi na doctor simnak de yobasi 1 hour golden hour ne di higher gasu koi majority that the koi more than 2 hours sang hai adu hai dana America da adu chang hai dana koi seida adu chang ni hai na ngai lei bidina taba earlier the better thuringai hospital report to biba
the sooner the better oji doctor na habi sima loksin jare ado marak se doctor akoi hoji doctor tapi matam da heart attack ki hoji maruina first aid ana people bi budo first aid kar pi raga ise hoi yum da le minir missing sidi maruina sigi awareness si kaya di leiru duine ba ado kari guma thabak na re na traga kanom tawre ai se something goes wrong with my health na du harap matam da kari no khoni yum da kari tawbu ya bale
yum da dawbagi di first aid si khoi gi is a difficult question. In the West, it's there because there are different tiers of healthcare in the Western countries. The district level, the district nurses kind of like, having said that, koi shida situm to boya to boda di koi gi heart attack chest pain hayak tare ko chest thak narak pa the symptoms heart attack ki symptom oini hai na koi hujik su idum haja ge koi symptoms heart attack ki symptoms koi chahi de su haja ran haja se young age di ko below 30 da di koi gi aina hujik haja ki ba major risk factor for heart attack diabetes hypertension high blood pressure koi gi aduga koi history of smoking aduga dyslipidemia haidana cholesterol triglyceride wangba obesity leitwa adugumba oragadi heart attack gi orambagi changsi niamagasu pura leiti haibidi adeba it's not there so it's always better to take over precaution rather than under precaution aduna because heart attack is a killer disease aduna young unusually 27 years to show heart attack koi gi hospital la lakre treatment dogre adu fadana chakre tabodadi ma smoking heavy leba smoker oyeba adu ma leitaba su yawi leitaba mani su yawre koi gi risk factor leitana adu heart attack tawgi su yawi adu common oybi nate having said that it's always better to take precaution adu to report to the nearest medical center adu da bainoji first aid hygiene is doctor duna koi gi ECG to wire ko ECG the suspicious wire na confirm tawre adu orgadi koi gi magi ham ba pi ga do hida koi gi kono da antiplatelet haidana aspirin the loading dose haidana lei koi gi da adegi second koi gi antiplatelet si ani pinare as a standard practice as per the guideline from European association aduga from American British from Indian also from the CSI Cardiological Society of India su guideline puthokre adida two antiplatelets aspirin ga aduga clopidogrel natragana prasugrel natragana ticagrelor haidana lei adana masi CP horaga di si hana hamda dale the better CP horaga adagi transfer tongna honaba aduga patient gi da precaution longna honaba to thuna ambulance kauraga madugi nearest center da preferably I would say that this in the Western countries the tertiary care center tertiary heart care center high like Sky Hospital where all the facilities are available including life supports adu yobogam dragasu nearest kharchau hospital da specialist laibada aduga from adumaina tawduna the yumdagi then primary health center bo haire ko aduga dagi amuk aduga district hospital then to tertiary care center matam di yam logdaba yam thuna koi la horaga thuna ya horingai aduga mai gana se the chance of survival goes up very high
Dr. Simyam ngaje do Dr. si habi ingi sen tanja hamtang lor ai wahang sim dilo jeng sai gi koi lifestyle related disease and high tare sai gi hypertension wasnu diabetes wasnu sima adi obesity kare chaung noi basi si khangaba kangbu heart attack si torba ya bagi possibility si dum leibani na magi sign and symptoms na kone vividly akone khangje ba ba in a very simple way smai torga di oibe yai haina akona khangba ya symptoms si kama habi
age factors ko middle aged high ko middle aged see those patients in the middle age they are having one or more risk factor major risk factor has adu leiraga hidak charing aida if he or she develops symptoms like sudden onset chest pain yam khangogdana maram ire leitana thabaksi yam kanna na ba haidare yam kanna na ba adu humang thokna perspiration yauna humang thokna soron wana the ko kang au ba koi for no reason haidare thuna sudden onset ko ngawre kaina haina su tawda basi symptoms di haidana haiba patient na khan koi khanbada dumba ko dumle re aduga hoji si sore honba huju dungai sudden onset breathlessness marami jajana hanadagi koi smoking habit tagi khara sore warak padu hanaki sidi ngangai togidaba this first time I can't breathe adu koi thongna window daga chalaga breathing tawgi adugi su description jaw hejriba those patients who suffer from heart attack and having this breathlessness and he thinks that there's no air inside, that he wants to go to the window to take to find a breathing space. Adugumba symptoms. Aduga akhoi perspiration ariba akhoi nausea and vomiting haiba akhoi oning maram ijazadana ni khoi maram ijazadana oning then has an episode of vomiting. Maram ijazadana. See, this can be a manifestation of heart attack. Masi yamna ai viewers in the haise ke masi yamna koi misleading oi kana the puk ta na bani puk ki koi oning mane haidana o bani haidana wrong hospital da wrong doctor da chat khibasu yaur haise ba adagi di amuk Sky Hospital lag matam da di it was too late aduna see koi gi nausea and vomiting have see koi sudden onset ni ko aduga unexplained see heart is on the diaphragm see heart le record the diaphragm see on aduna heart ki inferior wall inferior surface si makha thang ba saruk si the heart attack tawraga di masigi si the inflammation tawraga the diaphragm si irritate tawba aduga di nausea and vomiting si it may be the first symptom aduna we should not ignore that.
Jadi habis itu sih, aku nak hana kangsit juga macam mana ni, doktor tapi sih mana symptom sih am kangum cengi apa, ada orang sagi vomiting symptom lebih sisu on other side masih cuma ipuk nama tu heart attack orang punya bagi itu kisah sih am lain na, doktor habis sih kangsit itu, doktor makan tapi call sini kerana mula apa saja. Hello.
Hello.
Tajra habis mingle film tapi uang anggu.
Good evening sir, I talk jelas saya semula nol devi itu uang lagi lagi.
Madam Lemhal, kari wang ang bigyan
doktor. Ay seperti kanjaning sir. Ay isa siko. Ay isa si tabu kamo ho tau ba wazu degi kaya kana tingne except gumba. Adun bematam da isa si sa so je tabi ho laga kaya wabu ko. Adu kan ngaya ka sumpotha ga budi adun farak patap na adu ka. Masibo heart ki problem oi doira si ka kanjaning adu ka to pa wahang amana. Masibo heart ki problem ga mari leina bo di karam machinjak sa ga phagada ge amadi lifestyle je karam ba oi na ga tawra ga khara se oi ga ga ha bi khangjaning expert ke
and the caller madam Lemhal gi isa gi chahi is de kya subire
ha isa gi chahi jiro isa gi chahi je 50 above hai ra tha
50 above doctor ke hang bi ni mole
weight of the habit
habit doctor dum
weight se
habit chorak pada katang mayam di kitang wang tak labra
hoi weight se 55 60 the man or mudang mane sab sa buje hujik
adu di yam badina te aduga si khoi gi weight si height ka mari lene wang ga mari lene aduga khoina BMI haidana body mass index haidana yam no koi 55 60 si foot manga ga foot manga dagi hen foot manga inchi ani mo ga di 55 60 si adum healthy weight range ni adide thoina wa bi ngai leti aduga sai weight aduga height sina wang basina andaraga di adu wang bra haiduma koi BMI haidana koi body mass index ma photogam darkar le aina hojik hangjarei si warobiya de si hangdaba yadabani aduga kaigino haida symptom si weight related symptom la haibasu koi heart attack ki di aina hajarani ko adu masi heart attack oi bayai oidaba ya haibisima hajarage aduga adu matungda amuksu koi gi gana se weight related oi bra haisu aina muk ai laksage aduga adugi mamangda koi gi si di medical gi nina aina hangdaba yadaba question ga di hangdaba tare koi gi thagi di lep khrabra aduga laibra
line se tatkre line se tatkre adumai se hi di yankai kharadi hele yankai 50 plus ne habiram karigumba madu lepkhiba mai menopause laktan lepkhiba wei taragadi hojiki wa ba choktha
aduni what I'm trying to find out is that whether patient has already attained menopause aduga menopause manipuri dadi kari
ꯑꯩꯈꯣꯏꯒꯤ ꯃꯥꯒꯤ ꯊꯥꯒꯤ ꯈꯣꯡꯀꯥꯞ ꯂꯦꯞꯈꯤꯕ ꯍꯥꯏꯇꯥꯔꯦ
ꯈꯣꯡꯀꯥꯞ ꯂꯦꯞꯈꯤꯕ ꯑꯗꯨꯝ ꯍꯥꯏꯔꯦꯀꯣ ꯑꯗꯨ menopause ꯊꯥꯒꯤ ꯈꯣꯡꯀꯥꯞ ꯂꯦꯞꯈꯤꯕ ꯑꯣꯏꯔꯒꯗꯤ ꯃꯥꯒꯤ risk of having heart attack goes up to the level of a man aduna before menopause the childbearing age the chance of having heart attack in women is less than that of men aduna protection pura pi haidina teko atai risk factor leragadi we have to take care of that aduni adugi duma ina khangjeningba aduga weight sina the breathlessness without diabetes breathlessness it is a rare manifestation or symptom of heart attack but like just doing some routine work over the household duty over the household activities the koi so hon ware haragati madugi du koi gi heart kira haiba madu yeng thokbi badi ya inu jai jidi baina heart ki echocardiogram haidana yam chamba pungkhai amde loiba adu dei di adum adugi normal function lai re haragati thoina waningai laitana adum punsi lembi ba yai
yam nungaji do call tak lo khosake
ani
hello
hello ai kon taw ye pom patai sat taw ba
sarat pom patagi caller sarkari wahang hang bigani doctor tapiu
aina hangjening ise awai thau je sabadi yadabani na sadabadi yadabani na sabata khoi da khare hena sapaga da wa makhan gi thau gi hangjening ba adegi atopa mana stroke taw ba matung da phara kan da na nga je yam toina saba phayena ai ba chu yaw ba sum ba sala ju hangjening ba
hoji ekoi gi sina heart attack ana haibani stroke ki wam sa pe panbire a thau si karam thau cha ga de ge cha dabdi ya de thau si dum janari ni na ana khoi gi stroke taw matung ana hai londa se
si stroke haraga su probably is related the adum yamna important question ai answer dok jage ai no jega haja gi bedum aina khoi gi artery sing si ko artery sing si da heart ki artery block to khoi obstruction piraga na akoi heart attack haiba aduga brain gi da piraga na ischemic stroke haiba brain attack so aina haja gre hana aduga sidi vascular disease ne badana hoja bagi e utong sing ji solak badai ne atherosclerotic blood vessel sing ji ne war pa aduna jigi regarding the what type of oil one should take aduga ngayam saga drive sima khoi thau sidi chadab dia de aduna khangi chaba thau sidi da oil sidi da khoina aina aigi patient sing sidi da advice dog jabadi khadang di tangi olive oil gum ko sunflower oil si dum phai haidna dum yam jabadi sunflower olive oil wore bari masa lage di excess of everything is bad including vitamins vitamin bago yam sarga di excess of vitamin kills a man haibasu lady aduna thau di handabadi amna phare aduga thumju handabiba aduga manipur da aina after 15 years of practicing in London and then staying in London aduga London gi practice ta haidai ni sai jagre London da including London ko United Kingdom the United States da heart attack ki chang handarei si awareness yam lairak padagi ni cha bathak pa lifestyle change torpa si handarak padagi ni aduna Manipur da generally ekoi gi thum si yamna khara helna chanai aduga nganam thumnam baina thum si khara hel madang tawi aduga ekoi gi kana si oil se thau se I'm sure you'll agree with me that my observation is that koi usowa sobda thau si yamaga hijang hauni haibagi wakanda thau si khara hena sina badawni tawi
saring su thongba thau thak pa
thau thak da in hana ju aigi koi gi press daga talk daga aina su hana su ai request tog jagi haijagi ko awareness program da koi gi usowa sob haitare ko koi gi sida koi social fees sida koi gi oil ga daga salt ka gi kana si chang si kala handan si aina in haijagi bani regarding the food ya koi gi fish eating ai haijagi quickly ko daga aina kuina Europe da lere panina ada yes sardine kaina lai ko aduga mackerel kaina they are proven with evidence they are proven with studies and trials the 3 omega fatty acid doesn't lay ba eicosapentaenoic acid koi sang harabda si ekoi gi sumba nga fishing si yawe haidana adugi di praman laiba aduna adu chaw haibadi ekoina advice tauba da adum ngamme duga state da koi gi Indian subcontinent phangiba row gumba ko sareng gumba white skin hai tar white skin fish leida sidi study trial makti ai udri aduga akoina su to bogi badu chance phangdri aduga yeng badadi thau ga koi taw badadi row ga si taw badadi thau gi thau ngak ta tholok badong to hejriba to madugi maduna koi gi thau yaw yamna yaw ba fish boire ko aduga meat boire si ka handar bibna di wagi lifestyle aduna better oini khandi
yam nunga je doctor si marak sida in tum listen jawruni asai doctor so happy pan bigraga palpitation mihunji not necessarily yam henna normally chong na revision at mihunji kana adun palpitation si yam wang ba haita masi su ultimately heart attack tor na bagi chances si yam wang in doctor habi base masi palpitation gi mandang si kitang panbiram ba yabra dai
palpitation si makal yam yami akoi gi anxiety dagi ko pakhat padagi natra kai mama unusual side ma ure ko mai mi kai mama mai hor kwa adu kai mama koi gi linne ubata suddenly yun jong basidi natural ni si science teki karya ko isli mai guji ki simai madugi haki dani adu gad mandang jagi ni adu na tabata marmi cha cha dana yun yamna chonga agadi ko ngawrak pa yabagi chance lai particularly if it is related to heart attack, it is to be taken very seriously. Maduna Miyunchongaba, Kongauraba, with some other symptoms of heart attack like chest pain, breathlessness, Soron Moarapa, Soron Fungalapa, nausea and vomiting, Oningba, Oningakpa, Orakpa, it is to be taken seriously and then one should contact doctors or medical center.
Hello.
Hello.
Tajare habiu. Ming le pham tak pi ro wang ngi.
Ai to jare ji komu se ko nage.
Maran Them Rajan kolar kombo se kon dagi. Kari wang hang begin kol tapi.
Ai ko ge heart ai ko se kanu se thaba se dai ba. Ni hun ji tang ni am tuin chung ba. Ma chi heart attack oi do ra na ta kari symptom oi do ni.
Hujikta just hujita ina hang je bo hang duma hoji kolar su hang bire. Almost answer di kumjagra bani do.
Tentak na hai jage. Koi gi sahi koi middle age hai tare ko sahi di fu mathak do ore aduga gi hypertension bp wang bi leire diabetes leire haraga di aduga koi mihun jong basi makhal yami aduga ina hajek da koi medical term da ventricular ectopics kaidan lai atrial ectopics kaidan lai ventricular ectopics oirambagi chance su wange koi gi bp hypertension bp wang amnina aduga koi diabetes leiramnina adu oraga di machine heart attack tawdring da symptom sign ama oibasu yai aduga ventricular particularly koigi ventricular ectopic saidana ventricular premature contraction hai bpc hai masi koina ecg tawda phangaga di adan we take it seriously and we just advise further investigation to make sure that this particular patient is not at risk of having heart attack haidana koina mathang my heart scan tawraga echocardiogram tawraga heart function kamain tawri heart ki function sonbra haibna yengaga madai coronary angiogram haidana tawraga yengaga adai sigi coronary artery heart ki heart supply tawriba e utongsi phunde natraga phulakpa hore dui matungina depending on that koi my treatment strategies ko na plan tawrani
jamnunga je hoji caller Rajan hambira ko hang pakum ji thamjare na call si marwina doctor si lenga ingai da ai line da su just on the track wang khar lejeri masi punamakta viewer sing su interest soidana lebigani khan ba wang sing ni wang amani dang ai lakchana be tanja su matam si tensil paga I logjege caller si ngaktan call si ai lepseraga ada hojik maruina modern treatment of heart attack have singa sigi thamjeri bu topic sini ado medical science ke advancement si di ayore hojik se maruina sky hospital su maruina cardiology gi aduna phaba khoi gi masigi setup system aduga no treatment si loina yam phange na adman tajeri ni Kramani no no treatment makalse heart attack have says the kari no ji paikal eba no line for tap things
hojik akoina callers dagi viewers dagi we learn from the viewers also that the time is very important time is essence aduna the quick response time haidana quick response time yam thuna patient with suspected heart attack si hospital laguma tamda yam thuna within akhoi Sky Hospital as per policy within 5 minutes akhoi di heart attack center haidana London da laiba HAC koi AC heart attack center haidana 24-hour service ne kaigino haida heart attack can come at any time of the day or night. At 4 a.m. we are awake, we are ready. Within 5 minutes da minute manga sidida koigi ECG am tawraga heart jack ni natti habisima ayam da dum khange maduna ambiguous hoiba habiti maduna borderline hoiraga di tai troponin ko ki cardiac markers lere troponin test tawre degi di adu atai tai echocardiogram so we give the patient the benefit of echocardiogram kaino da heart attack tawramaga di echocardiogram da magi heart ki movement ji function ji walam godoine ba. That is the main thing. Aduna adu gisu within half an hour within the same admission and before waiting the next day. If the patient arrives at Sky Hospital at 4 a.m. or patient may arrive at 4 p.m. the response time will be more or less the same. Aduni adudagi mai bigataba hojik hana first medical contact na hojiki first yet hypermakti na tre dogasu in dual antiplatelet hydrogen aspirin clopidogrel loading dose si pirak khabra the pirak tribra have the pirak tagadi immediately si the piba adudeki di magi hojik heart disease confirm tawra matung di magi hojiki thrombolytic therapy hydrogen clot bursting injections jo hai magi hojiki koi coronary artery hydrogen heart ki blood vessels blocked or is ayam thrombus oigale thrombosis then thrombus si clot bursting injection adu piraba matung dagi matang akoi aduna complications the early the better. If we detect the complication aduna all the heart attack patients they die of complication. And the complications it could be pump failure. Heart is considered as the mother of all organs. Sigi aduna sida ayamtanga andogege
the slide kumba yogi bradu
sida dum lere kai sida kanto the heart is considered as the mother of all organs. The heart gi kapthorak magi blood sina sina nutrition hajeriba matkugi machinjang ne ba kai vital organs sing kidney gi liver gi brain gi the heart itself also and other part of the body aduna hojiki heart attack tawragadi the pump failure is one of the common complication aduga adi amana arrhythmic complication haidana hojiki immunium chongba koigi VF ventricular fibrillation VF cardiac arrest haidana the cardiac arrest tawragadi chance of survival goes down. Hospital lairagadi chance of survival is high because on monitor the udoi never and within seconds, not to wait for minutes, within seconds the koina jump on and then give the electric shock to revert to the sinus to prevent death, sudden cardiac death. Aduna koi arrhythmic complication kawi electrical complications jo hai aduni ki kana sida is a part of the treatment for patient with heart attack. Aduga pump sina fail oirakpa matam sida koina hana we try with medicine inotropic drugs haidana aduga zik inotropic drugs sidaida response tawdragadi koina intra-aortic balloon pump haidana London nadi am toy sinare modern haibadi koi 21st century gi ne yamadi aduga koi Manipur dasu we have started using it and then we use it when it is required. Aduna hojiki intra-aortic balloon pump si sidaida laira si intra-aortic balloon pump hapa patient ni aduga sigi balloon si koi khubi amuk chawraga groin dagi kamyap sidagi thingjallaga heart ki yorom daida left subclavian artery haibama artery am lai adugi makha oira na thamba adagi renal artery kidney da changba artery dagi marak sei da thamaga balloon se amuk kamthokba amuk inflate toba amuk deflate toba aduga koi heart ki circulation si improve to honba aduna
sisu anuba laing makhala mane laing
anuba makti haiba Manipur di yes it is life saving aduna that is the only way to support the heart when the heart fails and when the failing heart does not respond to multiple inotropic drugs.
Sisina hojiki Dr. Tapi Pasing si odorine da hojik salpatan ja sidani magi prevention si sai Dr. Hob da panbi badu aduna section ba habis de hena phab leite hena sine su take home message oje duini ado prevention is better than cure havenina heart attack si torong tanana ba ko ne individual amna masi kari kari section torang lo hot kadage khara di pan beger ne just something remind to be collect to be ga ongda habi
masi gi baman quickly ko ai na mention ko gi probably because of constraint of time I was also running fast degi coronary angiogram angioplasty duga balloon angioplasty and stent hapagi sima it has got a vital role. It has got to be done nowadays from all guidelines from anywhere either it is British guideline or it is European guideline or American guidelines or Indian guideline, Indian Society Cardiology Society of India's guideline. This balloon coronary angiogram yengaga sida khoi kana si artery se kayam block toge na sila isini artery block tawri si sida koi guide waya na thingjallaga balloon na kam thoga stent hapaga jegi yeng see blood supply is pura restore tawramni ada normal down jelabne ado di patient hingdingai daga hingdingai leite
also utpidis ne
thing you pura coronary angioplasty and stenting stent hap kre the patient ki bai blood vessels ji ba khoi blood circulation ji hana block to le base yeng bio base da bai ji pura 100% obstruction to gram mai blood supply je sida yeng bio ko se sina stent hap matung ni hap tri mamang sida amtanga sini hari detector to bai si sida ase balloon kam thoki sine balloon kam thoga stent hapakwa sine daga blood circulation ji restore tawwa sini
sina uji hari facilities ma'am sky hospital
la loina leire aduga akoina masi routinely we perform this routinely aduna hojiki ngasai koi gi viewers sing hangbi gi beda heart attack tawra matung da amu heart attack tawrakadra tawrakidra hai balloon ji kam balloon na kam thoga ko inflate tawraga the stent ji haporaga stent ji fazana well placed thamraga aduga masigi instant stenosis laktana ba instant thrombosis laktana ba hidak si khara kuina saraga di chance of ko yana da heart attack ki koi amuk lakida hai ki basi masu yamandarani
yam nunga je doctor du aina sahaj ni prevention matang line amani dang
ai jage uji aduna koina risk factors si koi discuss tawbada yaw gre ko koi major risk factors hypertension bp wangba diabetes history of smoking and dyslipidemia cholesterol lipid wangba sedentary lifestyle sigumba asi lairagadi yauragadi masi control tobiba aduga sedentary aduga exercise tobiba healthy eating aduga reduction of salt intake aduga oil thau yam sabidaba avoidance or reduction of taking red meat and regular exercise healthy lifestyle it will help reduce or prevent the heart attack
yan munga ji doctor asi si sagi asun mutum pura mukai thokpiraga hello doctor ki thorom sa yabiba maruina bior singi mafamda anuba heart attack line pathap ki matangda maruiba aikoina khangjidiba wafam mayam thambiba sigi damukta ngakhalidina doctor bu thaksa phongduksali hari wafam thamjaba loina ngasi ki matang hello doctor ki thorom loisinjare neng tabiriba bior sing amukana khurumjari